Doc, I don't ever recall my pediatrician telling me when I should start taking my son to see the dentist. Can you take us right back to the beginning and tell us what is the right age to start?
Right. Yes, with regards to dental checkups, actually, the earlier the better. We recommend that the baby has their teeth, not really their teeth, but really has an oral check when they are about between 6 months to a year old. It should be around the time when they get their first tooth. Yeah.
Right.
And of course you might think, what is there in the mouth of a 6 month or
6 month
eight
old.
month
Yeah,
old
yeah.
Yeah,
Yes.
what's there, right? But it's really not about what is there, it's really about what's going to be coming in there. So we want to make sure that parents are aware on how to look after the teeth when they come out. So it's more of preventive advice and anticipatory guidance at that age, because when you see your dentist at that time when they are about a year old, the dentist would go into the diet and what the weaning diet and how their oral hygiene habits are, how the parents are looking after the teeth, and some guidance can be given well before the problems come. So that's why we actually recommend within the first year of life. Yeah. And I suppose a good milestone is the first birthday, is to think, my baby's first birthday is coming up, it's
Mhm.
time to visit the dentist. So that will be a good milestone to help parents remember when to start seeing the dentist.
That's some birthday present, man.
Yeah, that's actually, this is so incredible because, you think, okay, well, teeth just erupt and come when they come. It's not something you need to check up on. And I'm blown away because, my sister's being diligent about this, but I never knew about it. Um, the advice that the dentist gives you, you were mentioning about weaning and stuff like that. Why is that important?
That's very important because culturally, I believe we sometimes tend to give our children or introduce sweet snacks to our children at a very,
Mm.
very, very early age. Like, we enjoy our chocolates and ice cream.
Mm,
And when we have our 12-month-old baby around, and we're having an ice cream after, say, lunch, you're bound to kind of, a little spoon for the little one.
Yeah,
So
yes.
yeah.
that kind of gets the sweet tooth going quite early on. And we normally advise, I mean, even the pediatricians and the medical doctors do say, try to keep the what we call as added sugars, the foods which have got added sugars, to a minimum, or better zero, salt and sugar to a zero when they are under 2. Is not to
Right.
introduce it too young, so they don't get a flavor for it, one thing. And the second thing is, that's the time when the teeth are actually coming through as well. We don't want it to be exposed to high sugar content at such a early stage.
Right. So right
We,
from the get go, no sugar. Okay.
yeah, no added sugar. I'm
Yep, yep.
talking about sugars which are added into the foods,
Sweets and
like
stuff.
when we talk
Okay.
about snacks and
Mm,
things. I mean, fruits and vegetables. So, yeah, enjoy your fruits.
Yep, yep,
They're
yeah.
sweet, and enjoy them as much as you can, because they're
mm,
wholesome. We don't want the empty calories, basically.
right.
Yeah.
Okay. So going back to sort of my not visiting a dentist with my
Yeah.
son, in
Mm-hmm.
time was due
Mm-hmm.
to absolute ignorance. Okay.
Yeah.
In your experience, besides ignorance, are there any other reasons why parents delay taking their kids to the dentist?
Well, I mean, as you said, the most common thing is most parents don't know. When they do show up, they say, you know what, I didn't know, I should have come sooner. That's the most common thing. Apart from that, sometimes it might just be, parents are very busy working, and, children going to daycare, school. Some of them are already in daycare and Tasca at a very young age. So all these things come into play, and they don't. I think it's mostly awareness that results in parents not bringing their children to see the dentist.
What
We need
about
to increase
fear?
the awareness. Sorry?
What about fear? The parents'
Yeah.
fear of dentists.
Yeah, yes, that is there too. The parents fear, actually, that's an interesting thing that you brought up. Parents' fear of dentists is what is actually one of the common reasons why children fear dentists, because they tend to reflect parental anxiety. They can sense, mommy's a bit worried about today. So they, in a more subconscious way, they also play up because they can sense mommy or even daddy's anxiety before a dental trip. This is especially so for the very young ones. They can sense parental anxiety. So they may not have any problems, but they could become very agitated at the dental office at that time because of this. Yeah.
And of course, that compounds it by saying, okay, that was such a stressful experience because they were already feeling stressed, that's what they remember. And so that's how it carries on. Is that
Yes,
how it rolls on?
that is, it is so true. Which is why usually when they do come to come to the clinic, we try to break that cycle. To say that the child is all right. Sometimes I tend to speak to the mother or the father first before actually getting the child into the room, because I want to kind of address parental fear first.
Right.
To say, look, we're just going to look into the mouth, and maybe you can help by telling your child that, we're just going to have a look into the mouth, maybe brush your teeth, that kind of a thing to the child. And addressing parental anxiety is just as important as the child themselves. Very
I
true.
love it.
Yeah.
It's like, no, your kid is fine. It's you that's the problem.
Isn't it always, right? Oh, dear. Just as an aside question, Doc, before I move on, but are you afraid of having your teeth done? Are you
Oh,
scared of the dentist?
that's a personal question, huh?
Oh,
but,
okay.
but I'll be honest here. I'm not afraid of dental checkups. I'm fine with that. But I do know from my own personal experience that having the drill is really not very comfortable. So I completely understand how patients feel, and and I suppose that means, we make extra effort to make the patient feel comfortable.
Oh, that's
Um,
true. Yeah.
but the thing is, I find that people respond differently. Some are able to tolerate a little more than others. So I guess our bodies are all different.
Yeah,
So it
Mm.
because
happens that
honestly,
way.
when the
Yeah.
drill happens, right, or whenever an extraction happens, let's say I had one recently, right, um, it's not painful. It's just a
No.
weird experience,
Yes, it's
you
a
know.
weird experience, and the oral cavity being so close to your ears, any sounds, anything, it just goes bang in the head for
Yeah,
you. So it can become very, very threatening,
yeah,
and especially so for very young children. So normally we do try to prepare the child to say, you might hear some sounds. We do try to prepare them to make sure
yeah,
that they are anticipating it, and they don't get into a shock, and then you start getting the fear coming in.
yeah.
Yeah.
But remember, dental rhymes with gentle, so it should be
Yes.
yeah.
Okay.
I like that.
So let's get into some of the nitty gritty then. In the cavities, let's dig into the cavities of this. What are the main things the dentist is looking out for in young children?
All right, let's start with the very young, yeah, the children where you might think there's nothing in the mouth. Why am I seeing the
Mm,
dentist? Let's start with that scenario. Most importantly, we want the child and the parent to be on a path of preventing any oral health problems. So mostly the very early appointments, early age appointments, would be focusing on making sure that there's a good routine in oral hygiene. Yeah, parents know how to look after the oral cavity well, and then establishing a good dietary habits as well, to ensure that there is not a high sugar diet, as well as not too frequent sugar diet. I mean, let's be realistic here. We can't really say, don't have any ice cream,
yeah,
chocolates. It's not going to happen, especially when the child's older and going to school.
Right.
And so the idea is to limit the frequency, maybe keep it to a day or two in a week, and ensuring that they brush afterwards. So that's how we kind of mitigate the effect of the sugars.
Mm-hmm.
So that's for the very, very young. And then for the slightly older child, we say in the age of 6, 7, we want to start looking at how the teeth are developing, whether they're developing in the normal pattern of growth, whether there are any potential orthodontic problems coming up, because we then can advise parents accordingly as to what we can anticipate, and maybe some prevention in that aspect as well, if needed. And of course, when we have these dental checks, we are also looking out for signs of early cavities, because we can spot those early cavities as well. Apart from that, we also can ask, when we take a history from the parents, we can kind of anticipate, based on their habits and their behaviors, whether they are at risk for getting caries. So we have something called a caries risk assessment, which we actually can, which helps to evaluate if this child is at high risk for dental decay, and we can advise accordingly. So those are all the reasons why, a dental visit would be more preventive, rather than going in when there's already pain. Try to have a regular check so we can
Right.
Mm.
prevent a problem. Yeah.
Don't fix it. Manage it early on, then you'll be fine. Then you don't need to
Yeah,
fix
yeah.
it.
Don't
Right?
go for fixing it, because when you come for fix, a lot of children, when they already have an issue, they are aware they have a dental problem,
Yeah.
and they become fearful only because they know they have a problem.
Yeah.
You
Right.
see? Yeah.
I mean, aside from sort of things that are physiological, um,
Mm-hmm.
what kind of other things impact or would cause problems with teeth? And I'm thinking more along the lines of, when you're taking your child to the dentist along these milestone markers of checkup dates, as it were, checkup
Mm-hmm.
birthday dates. I
Mm-hmm.
like that as a reminder. Um, does sort of medicine affect your teeth? I mean, besides diet and physiological stuff, does medicine affect your teeth or?
Well, you're right there. Some medications do, because a lot of the medications which children take are syrups. Yeah. So I mean, if in a healthy child, that's not an issue, because if they fall ill maybe for a week, they might be on some sort of medication and then they recover. But when we have children who have chronic medical problems, yeah, for example, some might be epileptic, or other situations where they need to take daily medications, then yes, it does have an impact. Yeah. We do try to recommend sugar-free medications, syrups, which have got what do you call, artificial sweeteners, but that doesn't, unfortunately, sometimes it's not available, so they do end up on the actual added sugar syrups. In those kind of scenarios, then preventive dentistry comes into play, because when you visit your dentist on a regular basis, he or she can advise you on how to ensure that these syrups don't affect the teeth. So we will actually advise certain things, like maybe gargle after the syrup, rinse out, and sometimes even the use of fluoride, but that would be tailor-made to the child. So we will need to see the child in the dental clinic, and then accordingly advise what can be done to prevent. But things can be done, so it doesn't affect the teeth in a bad way.
Right.
Okay. So things like, is it fake or false to this advice or this warning about things like inhalers and antibiotics affecting teeth as well?
Well, it's not fake as such, but how antibiotics affect the teeth. It's not all antibiotics that affect the teeth. Yeah. Of course, we talked about syrup. Yeah, the syrup aspect does affect to some extent, but the antibiotic itself, there are one or two antibiotics. There are some which can affect the teeth if taken at the time when the teeth are developing. That means the time when they're developing in the jaw. That would be at a very young age. Or even if mommy had that antibiotic when the child was, in the tummy. So that can have an impact. Yeah, most doctors are aware not to give pregnant mothers and young children these antibiotics. In terms of I mean, it does occur. We do sometimes see it, but it's very rare to have antibiotics affecting the teeth. Now, what was the other? I
Like an
think
inhaler for asthma and
inhalers.
stuff, those things.
Yeah, inhalers, it's mostly because of the steroid content in the inhaler. As you know, steroid suppresses the immune system. And we do have immunity within our oral cavity as well. And the reason why we ask patients to rinse after the inhalers is to actually remove any residual steroids in the oral cavity, so it doesn't impact the immunity level within the oral cavity.
Okay.
Mm.
So, when the second set of teeth come in, like if you've had a bit of a bad run with the first,
Yeah.
for whatever it is it like having a clean slate from earlier issues, or is it,
That's a good question. In some instances, it is, but it's not always the case because it depends on how severe a problem the child has had at a very young age. Like, take for instance, a young child, say 3, 4 years of age, who's just had some minor cavities which were restored, which were successfully restored. Then, yes, you do get a clean slate with the new teeth because these restored teeth fall off and fresh new ones come up. Now, in some scenarios, we have a situation where the baby teeth were quite severely destroyed by dental caries, and we were not able to save the tooth. The child had an abscess or a severe infection where we couldn't get rid of the infection and keep the tooth, and we ended up removing it. Now, if we had removed the tooth too early, then we end up with the issue of the space of that tooth being lost because it's come away too early. So what happens when a child grows is that uh, the baby teeth actually maintains the space for the adult replacement teeth.
Right. I see.
oh, it's like a
If
place
we
marker.
Yes.
Yeah,
Place
place
marker, yeah.
marker,
Yeah.
exactly. So if we end up not being able to save the carious tooth, and then we've got no choice but we remove it, then that space gets shrunk to some extent. In most instances, it happens more commonly in the back of the mouth than it does in the front aspect, but nonetheless it can be quite impactful because it would mean a whole tooth probably can't come out or comes out to the sides, which means the child may need some brace work later on to adjust that
Right.
back into alignment. Yeah, so it's not something that many of us think about, but it is quite important to keep the primary teeth in good condition, not only as a space maintainer but also for function, for chewing. If a child loses one tooth, it's not so bad, but once they lose more than that, then the function is somewhat limited as well. Yeah.
Unless, of course, it's normal, natural, like losing a tooth, front teeth, just like that Christmas song. And like, I think every kid's gone through. I mean,
Yeah.
that's
Yes,
normal kind of losing
that's
multiple
normal
teeth,
because
right?
when you lose one or two teeth here and there, you still have the others, to function with. So
Yeah.
that's pretty normal. Yeah.
Okay.
Okay.
Yeah.
Any other situations when, your baby teeth are really important
Say again.
besides
Any?
besides placement? Any
Oh,
other reasons your baby teeth are important besides the placements?
oh, all right. As Yes, the placement is one thing. The other thing is function, meaning to chew. Yeah. So as I was mentioning earlier, if we extract one single molar, baby molar, function is not affected too much. But if so many of their teeth are carious and we end up extracting, 4, 5, 6 molars, then the child is somewhat kind of having lesser teeth to chew on. uh, Amazingly, many children do adopt by just managing with their gums. There are situations where we can't avoid it. We do end up extracting multiple teeth,
Mm-hmm.
but to some extent function is affected. Speech is the other thing. Yeah, but although speech is, we do need our teeth as well when we are talking about speech. So we want to keep our teeth in good condition. For that's for another reason we want to keep our teeth in good condition, is we want to be able to be pronouncing our words well, as.
Oh, so it's not just about tongue. Our teeth are very important as part of how we speak.
Yeah.
Yes,
Never
speech
think about that.
development as well. Sorry.
I mean, one never thinks about that, that your teeth are
Yeah.
important for speaking.
Oh yes, they are. We
Well,
do
no,
need
yeah. You think about it, like if you want to say the word T or the or whatever it is, right? It's all about teeth, right?
Yeah, I
yeah.
need something to push my tongue up
Yeah.
against.
Right.
Wow.
It's not just something just to smile with, man. There's more to it.
Yeah, of course you want your teeth to smile with as well. So.
That's true.
Okay, doctor, what's the biggest problem Malaysian children face when it comes to your teeth? Now, you've mentioned the word caries quite often. Can you
Mhm.
explain more about that, and also perhaps what the biggest problem our kids face?
I think statistics wise, Malaysia has a very high rate of dental decay. You'll be surprised to hear the figure. We have a 70 plus, I think it's about 72% of our children who are under 5 who suffer from some form of dental decay. So that's very high. It's 72, if I'm not mistaken, our most recent survey. So it is extremely high. You imagine 70 something percent of our children, that's three quarters of our children who are under 5, having some issues with their teeth. And majority of it is because of either a high sugar intake, or the other issue that we do have is our children, our very young children, feeding through the night with their milk bottles. That means they go to bed with a bottle of milk and they knock off to sleep with that bottle, which means that they end up having residual milk in the
Right.
mouth through the night. Uh, don't misunderstand that, milk is good. They should be drinking milk, but it should be in the daytime when they are awake and able to, rinse out, or something like that right after their milk. When the child sleeps with a bottle, or even has multiple feeds in the night with the bottle, what happens is there is a lot of residual milk left in the mouth. And milk, as you know, has lactose is
Into
a
the
form of
sugar.
sugar. It's a form of sugar. And the bacteria in our oral cavity, which is there in all our mouths, you have it, I have it, so everybody has it. But the bacteria is kind of having a party in the night because, yay, I've got lactose. so
Right.
so the bacteria is kind of busy digesting it, producing acids, which are then causing the teeth
Right.
to, demineralize. In a way, it's eroding the teeth. So this
Mm.
happens throughout the night. So when we have uh you know the 1-2 year olds still feeding through the night with multiple bottles, it becomes a problem as well. So, what our advice usually is, we do have to work with the pediatricians closely here, because sometimes we have children who have certain medical conditions where they are not thriving and they do need regular feeds.
Yes.
So, for those children, we give the support in terms of prevention to try and mitigate the risk of caries. But for the healthy child, the best thing is for them to be able to sleep through the night, because if you think about the general development of a child, a lot of growth and development happens when they're asleep.
Mm.
So getting up to feed is also a disturbance on their sleep. So after the first birthday, ideally, they should be kind of working towards getting the child to sleep through the night. And parents should encourage the child to sleep through the night. Added bonus, mommy doesn't have to wake up to mix a bottle.
Yeah, I mean, my kiddo didn't, and so what we always did was have a sip of water after having a drink of milk,
Yes.
when he couldn't settle,
Mm,
because he couldn't thrive very much. He
Yeah.
needed that top
Okay.
ups and stuff. But it was
yes.
like, finish your middle, okay, have one last sip of water at least, sort of that,
Yeah, because what
Yes.
you don't want it's like, yes, you help the child
Mm,
thrive by drinking milk, but then you're causing other problems with
problems
this.
elsewhere.
Yeah,
Yeah,
yeah.
that's a good
Yeah,
idea.
yeah.
Right, yeah.
So
Yeah.
for those children with special requirements, we do
Mm,
usually give advice exactly like what you said, Asha, is
yeah.
to give them a bottle of water afterwards. And then, when you come to the clinic, we'll usually top it up with some fluoride and things to
Right.
help mitigate
Okay.
the effects on the teeth. Yeah.
So, you've mentioned sugar and then you've talked about the sort of milk, but mainly it's because of the sort of the lactose and the acid and stuff. Can you tell us exactly why sugar is so bad for the teeth? Like, what does sugar actually do to the teeth?
Okay, this goes back to what what the bacteria does in our oral cavity, because we all have different types of bugs in our bacteria in our mouth. I mean, it doesn't sound nice when I say it, but
Yeah, I'm very conscious about it.
JD,
Yeah,
by the way, is OCD with germs, so you're just making him feel
yeah,
really
hi,
ill right
yeah,
he's
now.
gonna go off now for a mouthwash, I'm sure.
yeah,
Yes.
yeah.
Well, they are the bugs. Bacteria are not always bad, so to speak. Yeah, we have good bacteria, and we
Buddy
have
bugs.
yeah, we have bacteria which help us with our immunity, and there are bacteria which don't. The thing that the sugar does, and there are many types of sugar, all these called lactose, glucose, fructose, galactose. When we read labels, these are all forms of sugar, caramel and things. So what these sugars do in our oral cavity is that the bacteria starts to ingest or digest, in a way, process these sugars, because it's a source of energy for the bugs, for the bacteria. Yeah? And one of the byproducts of this digestion, so to speak, of the sugars by the bacteria is acids. Yep, acids are produced in the oral cavity. That overall causes the pH, or the acidity in the oral cavity, to drop. Yeah, the pH level to drop, which means the oral cavity becomes an acidic
Very
environment.
acidic. Yeah.
Mm.
And we know what acid does. Acid is erosive. It
Yeah.
erodes.
It
Yeah,
eats away at things.
eats away. And although our enamel is actually the strongest tooth structure we have, the strongest structure in the human body, uh, it is very easily eroded by the acids produced by the bacteria. And so what we have is little areas of what we call as demineralization. That means the minerals within the enamel start to leach out because of the acid environment. Now, you're getting worried, are we?
Yeah. Yeah. I am.
And so what happens is, with the leaching of these minerals out, it softens the enamel, and eventually the soft enamel just breaks down and becomes a cavity. So we end up with a cavity, and now we have a beautiful cave for the bacteria to go and
Okay.
sit in.
Right.
Yeah,
Right.
right. So this is a beautiful cave for the bacteria. Now they have got, yeah, I've got a home, because once it's a cavity, then it's kind of protected even more from the brushing, and food gets
Oh, I
actually
see. Yeah.
stuck
Yeah.
in
Yeah.
there.
Mm.
Yeah, you get foods getting stuck in that cavity, which then even provides it a protective environment, so to speak, for the bugs to continue their activity. So this is why, when the cavity is small or medium sized, we do want to fill it up again. But when we catch a child with the demineralized phase, where we just see the enamel softening, then we don't actually do fillings. We can do preventive measures. We try to reverse the effect of that with preventive measures, if we get to catch the demineralized teeth early on. Yeah.
Wow.
So
So
All from
preventive
sugar.
measures can be done at any stage of life or only at
oh
the beginning?
yes. No, it's not specific to children. That can be done at any stage of life. Sometimes we have teenagers or even adults where there's been a change of lifestyle. A young adult going off to work, in a place where they're suddenly on their own, and they
Mm.
end up in change of diet. They start taking a lot of Coke, for example, or any sort of aerated or carbonated drinks,
Mhm.
and then you start having a high sugar diet all of a sudden in an adult. They could also end up with these early cavities as well. And these preventive measures work just as well. They
All
work
right.
So
just as well in anybody.
what are they?
Okay, what they are is mostly would be the dentist telling you to brush your teeth, of course, with a
Yeah.
fluoridated toothpaste. Yeah, using a fluoridated toothpaste. With children, we usually say when they are under 3, just a smear of the toothpaste, and then when they are a bit older, 6 and above, we do say a small pea-sized amount of the toothpaste for children. Fluoride toothpaste. That's one. The second thing that can be done is, in the dental office, your dentist can apply fluoride, which helps to remineralize the areas of the teeth that have been softened. It kind of tries to cover the areas with fluoride to help strengthen those areas again. Yeah, so that can be done in the dental clinic. In addition, the dentist would probably go through what your diet is like and where the risk for these cavities have come about from. So we
Mm.
try to identify what are the lifestyle factors which have caused these issues, and then give you the appropriate advice. Like I've mentioned to you, sometimes we have teenagers suddenly have discovered carbonated drinks, and they just go on
Yeah.
that. So
What do you have for
Or,
dinner?
tired, exhausted mothers who
Yeah.
sneak marshmallow bags
True, yeah.
at bedtime
Yeah.
because they're so exhausted.
What's for lunch? Cheesecake. What?
Yeah.
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 So these things
Um,
can be done. Yep.
okay, that's good to hear. All right, just a couple more very quick questions. What would you say, quick fire, is the best way for us parents to ensure that we enforce good dental hygiene on our kids?
Okay, the best thing, of course, is to get oral hygiene habits into a routine. That means from a very young age, get it established. We brush your teeth morning and night before bed, at least twice a day. Yeah, if you can do three, it's a bonus. But the very minimum is once in the morning and once again at night before going to bed. Keep that as a routine every day, so the child understands this just happens. Before bed, I brush my teeth, and the brushing has to be, for a very young child, supervised by the parents, meaning parents assist to make sure it's done properly, but at the same time encourage the child to do it themselves, because we want them to learn how to do it independently. So that's the most important thing in terms of oral hygiene.
Mhm.
And then the other thing is the use of a fluoride toothpaste. As recommended, under the age of 3, we just use a smear of the toothpaste for the child. And for an older child, we can actually use a peanut size, older meaning 6 years and above, a size of a pea, that amount of toothpaste. And 6 and above, we will usually recommend that they have adult formulation of the toothpaste. Your dentist may advise differently based on their, I mentioned the caries risk assessment. So your dentist may advise differently based on the individual needs. But in general, that's what we do for oral hygiene. The key to it is just brushing at least twice a day. Get some toothpaste, toothbrush into the mouth, and
Right.
Get those
do.
brushes into your mouth. That's that.
Yeah, but the thing is, Doc, like every time, like I remember back when you're a kid, right, and you go see a dentist or whatever it is, and I'm not sure whether it's a doctor or a dentist, right? But we're talking about the dangers of added sugars and brushing your teeth. You need to brush your teeth and whatnot. Then after that, I remember very clearly that it's every time I go see a dentist or doctor, I'm not sure. At the end of the visit, they give you a lollipop.
Yes.
Really?
Yeah.
It,
Yes. I had that
What is the point of
too.
all this
You've
sugar
been
bad for
such a
you?
good girl with your teeth brushing. Have a lollipop.
Yeah, right. So is it to make sure that we keep going back or what?
good for business, huh?
I know
Yes.
exactly, right? So that
Well, no, I don't know of any dentists who give lollipops.
right,
I don't, but that we normally give stickers, by the way. But
right,
with sugar, I think maybe. And now I recall when I was a kid, when I went to see a pediatrician, I remember getting a sweet as well. Now,
right.
now,
Uh,
now that you've brought it up, when I was a kid, yeah, that was, I know, many donkeys years ago. So,
same with us. I
Yeah,
think
same
we're
here.
the
Yeah,
same
yeah,
donkey cart
yeah.
there.
but I hope it doesn't happen anymore. Awareness, I hope, is there, because sweets is not only an issue with teeth, as you know, it's also an issue
Mm,
with childhood
Yeah,
obesity
yeah.
and so many other health issues. So I really hope it's not happening
yeah. No, lah, I'm pretty
anymore.
sure it doesn't. I'm very sure now the dentists go, "You've been such a good boy. Here, have a celery stick."
Yeah, I'm sure maybe with dentists it doesn't happen anymore, but
Probably not. Yeah,
I know for a fact it happens in doctors
doctor's
still.
office, right?
Yeah.
Oh,
So,
really?
Dr. D, if you're getting rid of your great chewy sweets, I'll take them off your hands.
Well, let's hope there will be a shift in that as well. What I normally do is I give stickers, or sometimes you've got this tiny fancy erasers
Yeah, yeah,
and
yeah.
lots of other things we can give kids, apart from the sweet
It'd be
snacks. Yeah,
hilarious
hope,
if
hope
kids
they'll.
walk out with like, the dentist gave me a Brussels sprout. I'm like,
No, no, not Brussels sprout and broccoli. Maybe a sticker of a Brussels sprout. Broccoli, I might do that. But they're very happy, even with a sticker or a balloon. It makes them
Yeah.
very happy. It
Not
doesn't
balloon
have to be sweet.
stock. We have to save our planet.
oh
All
yeah,
right.
Yeah.
Yeah, that's true.
yeah.
Stickers are fine.
No,
Good point.
no, but let's try to let's do this every year. A different vegetable for dentist. This year Brussels sprouts. Next year let's try celery, and after that broccoli.
there was this that mother who's made edible crayons out of vegetables for kids. So maybe edible crayons
Edible
Maybe. You never know.
crayons.
as a gimmick. Who knows?
But
Anyway.
Doc, this was great. Thank you so much. Very, very insightful, very clear explanation of, like, I never knew about the fluorides and then like adult formulations for toothpaste and everything. Very interesting.